I am so sorry for the delay. You know what? Last night we were camping. It was my dad's 80th birthday the day before. We were camping in his garden last night, and we all woke up so early. I got all five children in the tent. We all woke up so early. We raced back here. We were early forever for preparing this show. Like normally we'll do it in 3 hours. We'd like 4 hours of prep this morning, and then the internet just went. So we got the Cat5 cables out everywhere, and anyway, we're here. Good to see you. And again, real apologies for being so late. Wow, what's going to happen? VE today. We're all doing that a bit different to normal. Loads of evidence suggesting from doctors that the best thing we can all be doing at the moment is eating real food. Because after social distancing and washing our hands, it seems to be real food is our best line of defense. And of course, we've been pushing the message about vitamin C, vitamin D and zinc a lot with some brilliant doctors and nutritionalists over the last few days, only then to get me slated by some of the powers to be. So today I'm delighted to introduce Jerome to everybody. So we've never met before. We would normally have a pre-show little meeting, but with everything that's gone wrong, you're going to be meeting Jerome for the very first time at the same time as myself. Jerome, good morning to you.
Good morning.
Hey, I'm so sorry to keep you waiting.
No problem. I've been reading the paper. It's fine.
Is that depressing?
Yeah. Trump, as usual, violence, people being blamed for the virus, confusion over lockdown. Yeah, not business as usual, I think.
Well, I'm going to put a smile on your face, hopefully. So last year, it was April. I was invited the following month to go and speak at the Public Health Collaboration, and they showed me the list of everybody was there, and it said Patrick Holford, or at least I thought it did. So I thought, well, I'd better read his latest book. So I rushed out and bought the book that you wrote together.
Right.
And I went to the brilliant book, which we'll talk about in a moment, went to the Public Health Collaboration, and we were all getting wired up with our microphones, and I got introduced to Patrick Holford. And I said, I've just finished reading your latest book. It's absolutely brilliant. What you and Jerome wrote is absolutely fantastic. And he turned around to me and he said, I have never written a book. I went, well, this is really bizarre. You're Patrick Holford. He said, no, I'm Patrick Holden from the Sword Association. So I didn't actually need to read your book as it happened, but it was fantastic.
Great. I'm very pleased.
Really fantastic, because I've been beating that low carb drum ever since I lost my weight. I was obese for 25 years. So I've been banging that low carb drum, but this gives sort of a nice balanced opinion of, sort of turning your carb machine on and off and how to do it. I thought it was really well written, and recommend it to everybody.
Well, I think one of the things that's kind of relevant for here is that part of the reason we wrote it was because of the extraordinary conflict between low fat and low carb. And, we're all told a lot about how what we need in nutrition and in health is evidence-based. And we've been told for years and years and years that low fat is the way to go, and that fat is dangerous and will make you put on weight and so on and so forth. And then completely, more or less out of the blue, a rival theory arrived, which said, no, it's high carbs that's the problem and so on. And there was this sort of ding dong, both, I was a low carb supporter because it seemed to me to open up all sorts of interesting possibilities. But it does tell you that what we're very often told, and this is something that's coming up with the vitamin C story, is that there is a body of people who say that's all rubbish. We are the experts, we know there's no evidence, and go on and do what you're told by the doctors. So, having done the hybrid book, I was thinking, we seem to be having the same kind of I'm the expert. And of course, the experts feel it's perfectly all right to shut down their people who disagree with them. That's another thing that I think's been very worrying about it, is the readiness of Facebook and Instagram and so on, YouTube, all to say, you've got it wrong, not just we disagree, but you can't hear this stuff.
Yeah, and certainly the vitamin C story, lots of people have been closed down on that one. So if we
Yeah.
if we lose a signal halfway through this show, we might know why. It might not be my internet upstairs.
Well, yes.
So tell everybody your background prior to writing this book, because I
Okay.
know you've been in this space for quite a long
Yeah.
time.
Well, have been doing it for a long time, and always been a journalist, and I started specializing in health and medicine about sort of 20 years ago, and teamed up with Patrick Holford because he was a very good person to interview. And whenever you went and asked him a question, he usually had a good answer and presented it in understandable bite-sized chunks and so on. And so we did a first book, which was Food is Better Medicine Than Drugs, which introduced me to a lot of information about how a nutritional approach could very often do better than one that just relied on a particular drug. Things like antidepressants and also the whole heart statins issue. So that was where all of that came out of. And really, it seems to me that the vitamin C story kind of brings all of those things together. The idea of the benefits of nutrition, the benefits of vitamins and minerals, and the way that there's a big attempt to control the message and to keep vitamins and minerals out on the fringe.
Yeah, no, I know when we first got in touch with you to ask you to come on the show, I said, look, let's just talk about this all day. And you went, well, that's very kind of you, but I want to get the message out about vitamin C. So what's your take on vitamin C, vitamin D, and so on?
Well, I think that what happened was that there was obviously all the panic initially with the arrival of the virus and what to do and so on. And then about 3 weeks ago, something like that, middle of March, information started coming out from China saying we're making a lot of difference to patients by giving them vitamin C. And they gave us some other things which reduced inflammation, which is one of the big problems with the virus, and also looked at what was going on in the blood. But the vitamin C was the basis for it. And when I was reading about that, it made so much sense because vitamin C is a key player in the immune system. And it does all sorts of things like increasing the fighters in the body, the immune system, defense system. Um, and it is absolutely central to fighting off a virus. And so that makes it doubly peculiar that we're now being told you can't learn about this. So I started writing about what was happening in China, and then it got picked up in America, and some critical care experts started making use of it. And it's now a kind of ongoing story. It'd be really great if the people on the NHS, the leaders there, were to say, hey, something really promising is happening in America. Let's give them a call, find out what they're doing, and run a bit of a test here.
Yeah.
But so far, there's no sign of that happening, which there's some more developments, which we'll talk about in a minute. But the way that it's ignored here, the idea that looking after your immune system is really not relevant to an infection is strange, especially when you're supposed to be evidence-based.
Yeah, and of course, with vitamins, there are what we call EFSA compliant claims that we can make around vitamin C, European Food Standard Agencies, and one of those is around the immune system. So for everybody to be trying to shut us down for saying vitamin C could be part of the solution, we're not trying to say it's godly or it's going to fix everybody. We're just saying it should be part of the, it's even in your own guidelines, your European Food Standard Agency, you let us say that it's good for the immune system. So just join the dots.
WHO say the same thing as well, even though they're often referred to as they're opposed to it. But they're not. They're put it in as a possibility. So you have to ask yourself, why is it that something that is very well known has really no side effects? It's always a dubious claim, and there are there's a loose bowels story, which for various reasons, which we'll come on to, is nonsense as well. Um, and it's also stupendously cheap. So cheap, considerable evidence that it's effective, and no side effects. And the idea that people shouldn't know about that is, you know, something else is going on, one feels.
And as a journalist, what do you think might be going on?
Well, I don't want to get into murky waters, um, but I think, well, actually, I think part of it is just the way that the medical profession thinks. There's a long, long history in the medical profession of not really taking vitamins, minerals, nutrition very seriously. If you go along, they always say, go and talk to your doctor if you want to take a supplement, but actually your doctor is not the best person to talk to. And the underlying assumption, if you are seeing your doctor because you have some problem and you've been treating it yourself by, taking some minerals, some vitamins, changing your diet, that sort of thing, going on a ketogenic diet, and you go back and say, hey, this is what I've been doing and I'm feeling so much better, and so on, they'll say, yes, well, probably a spontaneous remission. So, they're not up for sharing, saying, God, do tell us what you're doing because it seems to work. So that's the first thing. And of course, it's no secret that the drug companies aren't interested in testing or examining or having anything to do products which aren't patentable and which are cheap and easily available, which is kind of fair because, they're not charities, obviously. They need to make money and they're not going to make money out of that. But, and this is another sort of big area, but maybe we should be thinking about, and there are people who are thinking about saying, if there are things which are effective but aren't being tested or being used or taken up, maybe we should have a, whatever you want to call it, a government, a non-profit arm of the health service, which looks at that. They're actually discussing it at the moment for antibiotics, because antibiotics are the same. They are not very profitable, and pharmaceutical companies are not interested in them, and people are beginning to say perhaps the commercial model is not what we need. So, that's the financial interests are at odds with the kind of things that vitamin C is offering.
Yeah, I never thought about it the way you just said it. You said it so brilliantly that it's not the pharmaceuticals' fault for just turning a blind eye to it. They've got to dismiss it because they're a for-profit business. That's why they got shareholders. That's why their shareholders invest in those corporations in the first place to make profit. So they've got to really do everything they can to shun the power of something they could never make a profit out of. And maybe you're right. Maybe we have to set up a separate part within the NHS that's owned by the NHS that really does those clinical studies. And then, almost definitely, I would have thought that some of the vitamins that they've known for years, vitamin D, vitamin C, zinc, magnesium, all these things that we really believe in. Maybe it has to be on the NHS eventually.
Well, yes. I mean, it's a big area that we probably shouldn't get too caught up in, but there is a problem with it, is because the model that we have for testing things is the drug model. So if you say magnesium is good for you, or zinc will help your immune system and so on, the standard model is to run a test only giving people zinc, or only giving magnesium, or only giving vitamin C. And nutrition and the use of supplements doesn't work like that. They all interact with each other, and a lot of the drugs, a lot of the vitamins like vitamin C or vitamin E, which are anti-inflammatories, have to be refreshed by other vitamins in the body. So the model very often comes up with, it's really sorry, but we've looked at whatever it is, vitamin C, there's vitamin C for colds for ages, and there's lots of things for vitamin D, and they say, well, it doesn't really work. And it's not that it doesn't work, it's that you've got to find a way of testing it that gives you a meaningful result. And that's something else that may well show with vitamin C. Would it be useful if I was to address the issue, which I think is at the heart of the vitamin C thing, is that everybody knows that vitamin C is kind of good for you, and if you need your whatever it is, about 70 or 80 milligrams a day, and you get it from a couple of oranges and so on and so forth. And for a lot of people, I think there's what on earth, how can giving a couple of oranges equivalent of vitamin C to people with dying in intensive care, it clearly is madness and fraud and so on. So can I just
yes, please do.
take you a bit through that?
We've got some slides that you've sent over, which normally
Right.
I would have seen in advance. So you just
Right.
shout out which ones you want at any time. My son Jack is producing the show. He'll bring them up.
Yeah. So the story is that if you have lots of vitamin C, you get this loose bowel thing. And there's the other thing that we don't store vitamin C. So if you take a lot, all you're going to do, and you don't need it, you're going to pee it out and make expensive urine. Those are the two big charges against using vitamin C, which is true if you're healthy, if you're nothing else going on and so on. But something that a lot of people are not aware of maybe is that we are unusual in the animal kingdom in that we can't make vitamin C. Most other animals don't need to have extra vitamin C when they get ill, but what they do is make an awful lot of it. I mean, goats, I think, whose weight is probably about half of mine or less, they have 8 grams as a sort of basic amount in their system. And if they get an infection, that gets ramped up to, I don't have the particular figures, but maybe 20 or so, 30. So
yeah, I've seen one report that says 150. Let me get the right. 150 pound. No, that's really heavy. That's heavier than me. Is that right? Yeah, 150 pound go. I think it's something like 10 grams per day normally, but that can go up 10-fold to 100 grams, which just sounds off the scale ridiculous.
That's the kind of thing. So the idea that big level, and this is the key thing, is that vitamin C is it's got two faces. So there's the kind of calm day-to-day basic amount face, and that's what we all know about healthy balanced diet and so on. But it is also a soldier, a fighter, a defender, so that when you do get infected or you have a lot of stress or that sort of thing, your body is crying out for more. And if you because you can't make it, you have to get it from outside. And if that doesn't happen, what then happens is that your levels in your body go down and down and down. And we all know that the original discovery about vitamin C was in order to fight off scurvy. If you didn't have enough of it in your body, you got scurvy, horrible disease, killed you, and so on. And what's one of the discoveries recently is that people who have been infected by a virus and are having real problems with breathing, or a state called cytokine storm, where there's this the immune system starts to go a bit haywire and starts attacking the body. To deal with all of that, vitamin C is absolutely essential. It does all sorts of things about training up the immune system fighters, repairing parts of the body that have been damaged by the inflammation, and so on and so forth. And that takes a lot. And so what happens with people who aren't getting any additional vitamin C is their levels go down and down and down, and they develop a condition which is pretty well identical to scurvy. So we have a lot of the people who are sitting in intensive care or being ventilated whose body is crying out for vitamin C and has symptoms, and scurvy, of course, has a whole load of knock-on damage and so on um, joints and to connective tissue and all that sort of thing. So um, it's kind of, you keep coming back to this thing of it's doing so many useful things. Why not just give in and give it?
Yeah. And there's been cases, test cases in America, hasn't there? In New York, there's been, your good friend Patrick was saying that, they're now shipping it to lots of hospitals in China, vitamin C, by almost like the truckload.
Yeah.
And people say, well, it's not proper research. Well, we haven't got time to do proper research. There's evidence. And when you join the dots, it almost seems common sense that this is something we should be doing.
Absolutely. Well, in fact, there have been two very interesting developments this week, which is that some people like me and others have been crying out for the last sort of 3 weeks or so to say, for heaven's sake, just do some testing, find out what's going on, use it on patients. And there seemed to be a block on that in the UK. But now there is a big global research trials body called REMAP. It's called REMAP CAP, and it is running a big trial with about 17,000 people, and they're testing 19 different drugs, trialing them against placebos and so on, see how well they work. And as of last weekend, vitamin C was included on that list.
Oh,
and the really interesting thing is that in order to include it on the list, you have to put forward a document which says why you're doing it. And if I can just read you a couple of lines here from the REMAP CAP proposal to put vitamin C on the map there.
Okay.
And this is an official, very carefully done report, pulling in all the evidence and so on. And just there's a couple of points in here about sepsis. I just explain what sepsis is. Sepsis is similar to the cytokine storm. It's this dysregulated state where you've got lots of inflammation, and it's what a lot of the people who've been infected by the virus actually die from. But it's also a problem in its own right. And what they say here is that there's a growing body of evidence that vitamin C is an inexpensive, readily available intervention, potentially life-saving in cases of sepsis, and intravenous vitamin C, because there we go, we've got it up on the, excellent. Intravenous vitamin C may be the first therapy to mitigate the dysregulated cascade of events. This is again the sepsis cytokine storm that we're talking about, that lead to sepsis. If proven effective, vitamin C could be used worldwide and improve outcomes in high and low income settings alike. And then, as you can see there, it refers to a recent single center observational study. It means it was only done in one place rather than lots of them. 94 people, people who've got septic shock, same sort of sepsis territory, reported a dramatic effect on the vasopressor requirement, that's the ventilators. And those who were given the vitamin had a mortality rate of 8%, 8.5%. And those who didn't get it had a mortality rate of 40%.
Wow.
Now, not definitive, need more research, and so on and so on and so forth. But that is the kind of thing that if you had a drug, it would be, share price would be soaring and so on. So that's a mainstream body who's going to be testing it. And there's lots more evidence. They put out a big document which you can access on the web. So that's establishment, proper doctors involved in critical care saying, this looks really sensible. The other thing, which was also very impressive in terms of making the case for vitamin C, was that on Wednesday, the American Senate held a meeting, and here we have got some of the stuff up again. Excellent, your system's working brilliantly. And the first guy to come along and talk to the senators was, as you can see, Dr. Pierre Corey, who's a big name he's linked in with half a dozen other intensive care physicians who are doing this with patients in America in various groups. And it says here that the first 100, this is what he told the senators, the first 100 patients in the group were being treated in their ICUs, and they were using a combination of steroids, vitamin C, and blood thinners. Steroids are, of course, the anti-inflammatory hormone which is produced by the body, and also it comes in a drug form, so that your body would be making some of it, and the drug, the corticosteroid, would be added in order to increase the effect of your own steroids. And again, the survival rate of those who are getting it was extraordinary in these 100 patients who these critical care experts have been treating. None of them spent long on ventilators or became dependent on ventilators. Most of them had a short hospital stay in intensive care and or on a ventilator is about 50-50.
Wow.
So I do find it bizarre that it's not just being ignored, apparently by nearly all the national health, but being shut down, being banned. You can't know about this. That can't be right. And just the one other thing which was said in the meeting, there's another guy called Dr. David Katz, who's a leading prevention specialist, globally recognized authority, and he did it. And these can all be treated with lifestyle changes. It's the kind of thing that ketogenic diet, low carbohydrates, and so on all handle really well, and certainly part of the picture. So you could be attempting to help the frontline staff, people who've got metabolic diseases, by looking at their diets, looking at giving them, making sure they had sufficient levels of the various minerals and vitamins, and at the very least dropping the risk that they have of developing the disease. I mean, it's no accident that it's people with diabetes who have a problem, and also people in care homes. Yeah. Why do we think people in care homes are such big risk? Because most of them are deficient. Studies have shown this for years. Most of them are deficient in things like vitamin D, vitamin C, E, all the other things which are needed for the immune system. And their diets aren't fantastic either. They probably get quite a lot of sweets and puddings and cakes and all of that sort of high carbohydrate stuff. So there's a really clear picture, sort of rival, which has been bubbling away in the background, and suddenly faced with the biggest crisis we've had, is the thing that is providing an alternative, and I think it needs to be looked into.
Yeah, I mean, Dr. Aseem Malhotra's been banging that drum on mainstream TV, and the fact that we're seeing pop up on more channels everywhere at the moment, from the BBC to Sky, and then in all the newspapers. People are starting to listen. My only hope is that we don't have a short memory after this has gone, because here's the chance here's the chance, isn't it, to try and get this message across to those that are suffering, that don't really. My dad yesterday, 80, injects himself every day, but his doctor still says to him, Mr. Bennett, just everything in moderation. Yes. So he's still having the carbs and the bread and the pasta and the rice, and it's like, Dad, he said, look, son, you've written a few health books, but you're not a doctor. My doctor said, and I've been with my doctor for so many years, and I said, well, maybe your doctor needs to re-look at the evidence that suggests that, you know, all these things are linked to too much
and there is,
processed food.
are we all right for time?
Yeah, we have to finish bang on 11 because we've got a 2-minute silence today. But
right,
Jack's
okay.
going to for VE Day, so Jack will count us down at the end. We've got 15 minutes. It's all yours.
Okay. Well, the other thing, of course, the big irony of this situation, which is that reinforcing or strengthening the immune system is something that also makes a huge amount of sense if you're developing a vaccine. And we're all being told that we have to, you know, the vaccine is coming, big debates about how long. Most people, and I would be one of them, think that if you're going to test it properly, it's not going to be for a year, 18 months, even longer. And there are problems with vaccines as well. I'm not against vaccines. They're really useful. They make a lot of difference, absolute lifesavers. But sometimes the way that they're tested, and again, the attempt to lock down any discussions about it seems to me to be counterproductive. But the way that vaccines work is that they stimulate your immune system. And so if you've got an immune system which is on the floor, because you're in an old folks home, you're old, it's not working too well anyway, and you're not getting the support you need, sorry, I've just got a phone going here. Just get rid of it. Right.
Love the ringtone, by the way.
Not too alarming, it's soothing. So if you're in an old folks home and your immune system isn't really getting what it needs, the chances that the vaccine is going to work is not great. You know, if I was running a vaccine firm, I would want to make sure that all the people I was giving it to had really strong and active immune systems. Otherwise, the rate of success is not going to be that good. So it's a kind of win-win. At the moment, it's a lose-lose because people are told not to do vitamin C and the vaccines are coming along, and they're bound to have lots of failures because of all these people whose own immune system can't do anything about it.
Yeah, so you're absolutely right. So really what they should be doing is saying promoting vitamin C in the interim. Take that until we get the vaccine. Yep. Get your health sorted out, and then when we got the vaccine, it's going to be more productive, better results. They'll make more money in the back end anyway.
They'll do better. The vitamins,
the
vitamin people will do well, and so on.
Yeah. Fascinating.
In fact, there is a charity which I mentioned. Is that all right? There's
yeah.
Some details about charity who are providing vitamin C and vitamin D and zinc to distribute to health workers. And there is a hospital in Wrexham where amazingly 40 of the nurses there are taking the supplement regularly, taking the package regularly. And it's clearly not an evidence-based thing. At the moment, there isn't enough data on it to know exactly what difference it makes. But it does highlight one of the other things about this crisis, which is that the nurses all report that they really like having it. It makes them feel that they're doing something, and they can take part in protecting themselves. And the other feature of the way that this whole thing is handled is that we are all passive recipients. We all are, you know, we wait, we're told, you know, this is the lockdown, this is the social distancing, these are the rules you've got to follow. And there's really nothing, you know, if you would say, well, what can I do? Well, you can wait until we get an antiviral. Antivirals have been a real problem for another whole area for discussion. They've been made for HIV, and they come with a real burden of side effects. And so that you simply are a passive recipient of the skill of the medical profession, which is, you know, looking after you. But clearly the ventilators aren't doing too well, and there's a lot of debate about whether they aren't making things worse, and the whole process of intubation of you know, putting these things down people, and it takes over and their muscles get weakened, and as I've said, the success rates aren't that good, and the people who are taking the vitamin don't need it. So it's an opportunity for people to be involved, to take responsibility for their own care and so on. And that would be one of the things that would be great if that continued afterwards, that you had that it was actually recognized that people could take responsibility for their health. They could change their diets in various ways, the kind of stuff that we talk about in the hybrid diet, where you can how to go into ketosis, and you've got the extraordinary things which that does to the body. It turns on and off genes. It is able to make differences, obviously, to diabetes, but also possibly to Alzheimer's and so on. So there's a lot of ways that you can, by diet, affect what's happening in your body. And it gives people a chance to look after their own health, to be responsible about it, and in a way that they aren't at the moment. So that would be another good change.
No, Jerome, that's a really valid point. Dr. David Unwin says that one of the problems with over-prescribing all the time is that then people rely on the medication as opposed to fixing the root cause of the problem. So, not only the whole debate around statins, but part of the problem. Let's say Bloomberg were correct in that research that 300 people are needed to get one positive outcome, pre-heart attack. Well, that could be 300 people or 299 people taking the tablet and not making lifestyle changes, relying on the drug to do the fixing. And the reality is the drug was only going to ever fix 1 in 300 people anyway, or help prevent death. So you're absolutely right. Taking responsibility yourself and for your loved ones and your family, maybe that is one of the positives that will come out of this. Maybe more people will realize, and when we step back and look at the data and says, this really did only attack the very vulnerable and those with metabolic syndrome. Hey, well, if another one comes along, I better make sure I haven't got metabolic syndrome. How do I prevent it?
Right.
Then maybe this might be the message we all need.
Yeah, well, we have a serious problem with these conditions, and again, the virus is like a kind of spotlight that goes around on the scene and highlights things that aren't really working at all well. And of course, we've known that there's a growing number of people with these problems like obesity and diabetes and so on, these metabolic disorders. And if you look at graphs, it's regularly going up and up and up and up. And of course, the virus then has caught that out again and highlighted it and shown up that there are these people who are more at risk from it. So that the lessons keep coming in from all sorts of different directions. And one of the things that you were mentioning, David Unwin, and there are other people as well, people who are also involved in the low fat debate and so on. And I'm very keen on the idea of citizen scientists. There are a lot of people who are involved in these different areas who are saying, hang on a second, this doesn't seem to make sense, and the advice that we're giving over eating low fat and so on doesn't make sense. And there are people who are writing about it. There's a great nutritionist, Zoe Harcum, who puts all sorts of posts up which dissects the arguments saying that fat is a problem. And David Unwin, brilliant job that he's done and so on. So, but again, the system tries to push them, out to the edge. And one of the things that was really interesting in the Senate hearing was that it was something that at the moment could never happen in the UK. There isn't any forum where people can come along and discuss what's going on and what they're thinking, and the scientists and so on. I mean, we have SAGE, the group that is advising on treatment and so on. We're not going to have a Senate hearing publicly recorded and available for everybody to attend about what they're doing and put in input and give evidence and so on. And that's the sort of development that would make such a difference. We need a sort of democratization of medicine. Of course, it sounds ridiculous because, medicine is to do with experts and so on. But patients know an awful lot about what works for them, and they very often report side effects. Statins are a classic example. The official figures say that there are really almost no side effects, and patients say, well, hang on a second, this is happening to me and that's happening to me and so on. And then we get into how do we test it and what's the evidence and the rest of it. But there needs to be this sort of participation. And when you bring health, when you bring nutrition into the picture, it all begins to make sense, and you can put together packages that work for different people. So we can, we've got a lot to learn, not only in how you might treat the really serious end, but what you might do for ordinary people. And of course, the frontline staff that we're all talking about as being, how brave they are and how fantastic, and we're trying to get them protection and the rest of it. Well, protect the inside as well as just the outside.
Yeah, PPE is external. Maybe we need a new phrase for PPE internal and getting the inside sorted out. Let's draw this to a close by asking you a question. So I've noticed in a lot of the reports across different age groups, lots of people worried about coming out of lockdown, way more than I ever thought would be. I mean, seriously concerned about what will happen to them, their families, when they come out of lockdown. Asim Malhotra says within 21 days you can start turning around serious metabolic problems. So what is your tips from all the research you've done then? So somebody's sitting here going, crikey, the announcement's coming on Sunday. He's probably going to start to ease it. I'm really worried about going back to work. I'm a bit overweight, or I'm diabetic. What's the first things they should be doing right now to take care of their health as we step out of lockdown?
Well, I can't give, there's nothing new to say. There isn't a sort of special new one. I mean, the hybrid diet actually is a new way of looking at it, which might be useful for people, because what it says is that if you bringing down your glucose levels is a sort of good thing for your health anyway, because if they're too high, interestingly, there's a link between glucose and vitamin C. So they both use the same system for being transported around the body. And so if you've got lots of glucose in your system, which is what you have if you're eating the high carb diet with with your pastas and your bread and all that sort of thing, that's going to cause problems. So it makes sense to, if you've been sitting and binging a bit in your lockdown, I know that there are people talking about putting on weight and so on, to go on a low carb diet, maybe going into ketosis, because one of the other things that comes up with that is fasting. And fasting is a very old system for helping people to deal with various problems and infections and so on. So we talk about how you can do fasting, intermittent fasting. And the other thing about it, the diet, is that the low carb ketogenic diet is quite demanding. You're having to eat much more fat than you're used to. There are a lot of things that you can't have, and so it's quite a challenge. And normally, if you're just doing that, and you then think, oh God, I can't face another avocado, and I've had enough fish for the week, and I'm really fed up with coconut butter. And then you go off and you have a pizza, and that's all. You're busted, because you then come out of ketosis, and you'll have to then go back into it again. So you failed, and dieting is full of failures. But the great thing about the hybrid diet is that you don't need to fail, because what you do is you say, well, look, we can eat carbohydrates in a way you have low glycemic ones. You have that they don't have a high glycemic load. And there's a lot of detail in the book about what they are and how to get them and so on. And so you can have all the stuff that you're missing, and right.
Observe for VE Day.
Right.
Can we get you back to finish off the story at some time in the next week or so? Because it's fascinating.
Be delighted. Yeah, it's great. Lovely talking to you. Excellent.
Lovely. Thank you very much indeed. Everybody, that was the brilliant Jerome Burn. Sorry to have to cut short there, but it really is important that we respect the 2-minute silence that is due at 11 o'clock. Today's food fact is garlic. Garlic been used as a medicine for many, many years. Certainly something that we never run out of in our family. The few people that don't like the taste of it take it as a supplement. The rest of us, we put it all over our food. It's full of really, and Hippocrates, who said, let food be medicine and medicine be the food, was a massive supporter of garlic, full of, believe it or not, vitamin C and lots of B's and lots of other minerals that we need. Look at there, in fact, 2 of them there, vitamin C and zinc, 2 of the 3 that we know are certainly helping a lot of people at the moment. Sorry we were late today. Sorry we were all a bit rushed. Technology let us down. Maybe one of those vitamin C haters come and cut one of our cables, because when we recabled, it was all okay. Who knows? Let's not spread a conspiracy theory though. Jerome was absolutely brilliant there. Thank you to everybody that's been watching. Thank you for sticking with us through our various problems this morning, and we look forward to being with you again at the same time tomorrow.